Hi, I'm Susan Kimberly, the Behavioral Health Specialist here at Carolina Advanced Health. In this video, I'm going to be providing information about seasonal affective disorder, or SAD. What is seasonal affective disorder? It's a type of depression that occurs the same time every year, and it usually begins in the fall and lasts through the winter months, although some people do suffer from SAD through the summer. It's caused by a biochemical imbalance in the part of the brain called the hypothalamus due to decreased exposure to natural light, which of course makes sense in the winter months with shorter days and more time spent indoors. So this imbalance in the brain disrupts our circadian rhythm, or a body clock, which is our 24-hour sleep-wake cycle. And so researchers think that this can result in the symptoms of SAD. Doesn't everyone get the winter blahs? And no one likes gray, gloomy days. And most people do have seasonal changes in sleep, appetite, or energy, but not to the point of it causing problems in your daily life. About 10% of people, women more than men, do meet the criteria for a diagnosis of SAD. So what are the symptoms? Depressed mood, low energy, oversleeping, difficulty concentrating, increased appetite, sometimes with carb cravings, anxiety, a heavy leaden feeling in the arms or legs, social withdrawal, a loss of interest in activities that you usually enjoy, and possibly weight gain. And you don't have to have all of these symptoms to meet a criteria for a diagnosis of SAD, but these are some examples. So what can you do? First, it's important to start with good health foundations and as much as possible, aim for 7 to 8 hours of sleep per night. Get regular physical activity, preferably outdoors, and healthy nutrition. Try to get as much exposure to natural light as you can. So bundle up and get outside during the day, even if it's cold. And talk to your provider about other treatment options, such as SSRI medications or light therapy, to see if these might be appropriate for you. Well, what is light therapy? So light therapy is a form of treatment that can help reset your biological clock. So it could be as simple as getting outside daily into the natural light, even when it's overcast, to help combat symptoms. Some people choose to use a light box, providing a 10,000 lux dose exposure. That's about 25 times brighter than household lighting, and that can also be very effective. Light boxes can be purchased over the counter but aren't covered by insurance. So sometimes it's easier to start with trying to increase your exposure to sunlight because it's less expensive and certainly very low risk. So how does light therapy work? The light acts on cells in the retina, which is the tissue at the back of the eye, and it sends visual information to your brain. The light modifies the amount of melatonin, which is a hormone in your human nervous system, and it boosts serotonin, which is a neurotransmitter, and that creates an antidepressant effect. But you should always ask your provider before trying light therapy, especially if you have diabetes, eye disease, or bipolar disorder. So if you think you may have SAD, you can schedule an appointment with your Carolina Advanced Health provider to discuss treatment options that are right for you. You can feel better this winter.